I just wanted to make a quick video. Actually, it's probably not going to be so quick, but a video showing how I changed my site for my pump medication. So the first thing I do is listen to my dogs fight. Second is I got out all my supplies. So I have plenty of alcohol swabs, tape, Flonase, you'll see what I use that for, some adhesive, liquid adhesive to help my site stay in place, my actual medication, the syringe the medication goes in, the tubing, and some bandages to cover it up. So I also keep all my supplies in these nice bins I have. This is just my everyday stuff. I have an overload bin put away. So with that, I'm going to show what I have to do. So I'm going to put this up over here so you can actually see what's going on. Okay, so my last location was right, you can see it right here, and it's really red. I removed it today and I took a shower. It was 7 weeks old, which is awesome, blessing. So anyway, here we go. So the first thing I do, I decided I'm gonna use my arm today because I love it in my arm. You can actually see some of the locations that I've went in before, and there's still like hard knots. I haven't been in my arm for 7 weeks, so I went from my arm to my flank. So the first thing we do is, I don't know where exactly I'm going in my arm yet, but so I clean with alcohol a couple times. We'll go again. Whoops. Try again. Clean. I can't, seriously. Okay, one more time. I clean it. Clean it. So the injection site can actually go in any location that you have subcutaneous at. So, look at it. I got lots in my arm. So now I just touched my arm again. Okay, so I think if I do this, so I'm gonna let that dry for a minute. Use my handy dandy thing here. Okay, so the first thing I do is, after the alcohol, is grab the Flonase nasal spray, but I don't use it on my nose. So for this is an antihistamine for your nose normally, but what I do is I actually take it and I squirt like, I don't know, a bunch of it, and I put it all over my arm, because the reaction my medication gives me is like, is like a 3rd degree burn. So it activates a histamine response in my body, and my body fights really hard, really hard to reject my site. But this is one of the Flonase is one of the ways that it helps stay. So then once the Flonase is dry, it takes just a minute for it to dry. I'll move on to the second. Those okay, it's kind of still wet, because it is still wet. So I'm gonna wait. I'm gonna do some more. Okay. Okay, let me see. Okay, I think we're good. Second, after the Flonase, or actually this would be a third step. Third step is I take this liquid adhesive, and this I found because somebody else recommended it. It's not something my specialty pharmacy carries, unfortunately, because it's awesome. But I found it on Amazon. It actually is a liquid adhesive that makes my bandage and my site stay longer. So, and I've had this bottle forever, so it doesn't like, you don't use a whole ton of it. But, all right, so I literally take this, and it makes my skin super, super sticky. So I'm gonna like look in the mirror, not at the camera. So, okay, so I think, I don't want to go where here was my last one. I can still feel the knot under the skin, little scar tissue. Here was one too. So I think I'm gonna go like, right here. So, yeah. So I literally take this adhesive, and I do this all by myself. Eric has learned how to insert a site. It's been a while, but it is beneficial to have somebody else that knows how to do this, just in case something would happen and a site fell out and I couldn't do it. So when you hear that beeping, that's my pump. It's alerting because nothing's on it. Okay, so now this sticky stuff, I want it to dry somewhat. I don't want it to dry all the way because it remains it's extremely tacky. So in the meantime, while I'm waiting for that, I am going to show you what I do to fill my meds up in my pump, and we'll get the pump going. So I take my vial of medicine. This lasts not very long. Few, maybe 10 draws. 7 draws out of this I get. So the first thing I do with that is it's got this adapter on it, so I don't have to use a needle. So I literally clean the adapter off really well with alcohol swab. And then I have my 3 milliliter syringe, so I'm opening that. Needle, that goes in my sharps. I don't even use the needles. So here's the 3 ml syringe. So the amount of medication I will draw, it's different for everybody, but my dose requires me to draw 2.4 milliliters every 48 hours. So here I pull it back full of air. I attach, screw it on, flip it over, push all the air in the bottle, push and pull, get rid of air bubbles. Draw 2.4. Colby. Alright, so that's the med. Then I put the little cap on, take that off. So then I can take that part of the syringe off. My pump, really small. It's the same as what many people use for like insulin, but this is not insulin. Runs on one AAA battery. Beeps crazy like this when it's not happy. So putting this in there, then I have to play with the screen. It says cartridge removed, press OK to load. So OK, load. So it's drawing the syringe into the actual pump. So I wait for that to load. So it beeped again saying it's loaded. So the next thing it wants me to do is, it's hard to say, fill tubing. We're not there yet. So I'm gonna put, it's got a little cap. I have to take the cap and alcohol swab it through the thing, all the way around, attach this to the top. There we go. Pump is loaded and ready for when I'm ready. Okay, so now that this part is done, I go back to my arm where we're gonna inject my site. So I use, it's called the MiniMed Quick Set infusion sites. This is the insertion tool. Many people also do this by hand. I've never done it. I've never inserted it by hand. I find this tool works great. So I'm gonna put, I don't know if this is gonna work. So let me try something. Okay, I don't know if this is gonna work. Okay, there. All right, so here is the thing, and it's not loaded. Okay, so sorry, I'm trying to think of all these things that I have to do. All right, so I have my tubing, and right now I really don't need the tubing part of it for this part, but I do need, this is the insertion, or the needle. So what do we do? So I literally take this, and this has to go, see this little hole right on the side? This blue little handle, I'm gonna call it, goes right in there, okay? So it's already down in the locked position. So what I have to do is I take off the protector, and now there's the catheter, and the needle is inside the catheter, kind of like an IV catheter, but it's very tiny. So I have to take off these sticker protectors. So now you can see that it's locked and loaded, ready for me. So it's ready to insert. So here we go. Now I like it. All right, so now, all right, I gotta adjust my shirt. Okay, I'm going back to the mirror, but you should be able to see me. Okay. So now I can see where I picked because it's just kind of shiny. Okay. So I literally put this on where I want it, right here. Okay. Actually, I want it. I'm trying to figure this out. All right, so I actually want it up like this. I want the, yes, like this. I want the tubing to come out up top. So what I do to inject myself, so this is the needle. All right, ready? 1, 2, maybe. 1, 2, 3, there we go. Little tinge, not much, okay. So now the needle is literally still in me, so I take this button and I push it to release the contraption. There we go. Okay, so my site is in. So now I gotta take the needle out. So this is the needle, so you literally just pull. Okay, out. Okay, and my site is in. So I just kind of make sure it's all around sticky, or not sticky, it's just all adhered before I move on. So there is where my location will be for hopefully at least 4 weeks. Okay, next, what I do is I protect the site from being pulled out. So what I have to do is I have to take this off, the tubing. So you have to, and I always do this one. It's on my arm, I have to do it one-handed, right? So I literally have to push these two together, twist until it gets to that little arrow. So then I can put this aside for when I'm actually ready to continue with my pump. All right, so now that the site is in, I am gonna take, these are called IV 3000 pads. They're this big, they're not very big. And I use 2 of these to cover my site. So I actually take it and I cut it in half. Cut the other one in half. Okay. Now to put these on, I literally take it like that. Make sure it's on, take the corner, go like that. See, now it's on. That one's on. And I do that around all 4. Do that around all 4 sides. So that the white part of the infusion set stays in me. It takes some practice getting used to doing things like in the mirror and backwards, but it's now been almost 14 months this time that I've been on this medication, so not so bad. All right, so here we go. Last one. So, all right, site is all protected. All right, there, site's all protected. Looks beautiful. So now, back to my pump. And I am going to now attach, I take off this protective cover, and I attach the tubing to it. Okay? And then I have to hit the button and it says fill tubing. So we start, we fill, and we fill. And I wait until I see a drop come out of the infusion set here. So it should be coming. There it is. So then I stop it. Okay. So I go back. So now I am all set for doing. Okay, you're done. All right, that's fine. Okay, so I have to take my alcohol swab again, and this time I just clean the button. I call it the button that sticks out of this. So I clean it off my alcohol. This has not touched anything, so I have to line it up to the arrow and then twist. See, clicked into place. So now, back to my pump, and it says fill cannula. That cannula is like 7 milliliters long. It's not very long. So fill cannula, select it, done. Okay, so now I hit done. And my pump is on. My pump is on and running. So this This syringe in here will last me 48 hours. The next time I change, well, I will change the syringe and reload it with a new one for 2.4 milliliters, and then change the tubing. This site, I do disconnect every morning for my 10-minute shower, clean it off, and then reattach when my shower is done. It's just a pain in the butt to shower with the pump, so I just protect it and go on. So that is how I insert a site and refill my pump. So it is running. I have this little booty that a friend made me that I literally put the pump in, wrap the tubing a little bit around. Because my site is in my arm, I just cover it up. No one even sees it. I don't even care though. But because it's in my arm, I put it through my shirt, out my front, wrap it a few times, because the tubing's like 43 inches. And then I literally just shove this right in my bra. That's it. So that is how I do my subcutaneous remodulin medication site change. Like I said, I do this it varies, but that last site lasted me 7 weeks. I cross my fingers that I get at least 4 out of this next site. I don't feel anything right now, pain-wise. My pain from the medication should start, it's different every time, but probably a couple hours in. So mid-afternoon, I probably will start feeling the medicine literally start burning me. And I can show, I forgot one step. I can show how red and inflamed it gets. But okay, I just have a piece of tape here, and I just like to secure it. So if the tubing gets pulled, it won't pull out my site. It will just, it will pull on the tube and protect it. So that, I forgot to do that part. So that's it. So I just put everything away. I have 2 needles that go into a sharps container. And that's it. So that's what I go through. It doesn't take me this long every time. It only took me because I decided to make a video, but that is what is involved with my medication. So if you would say a prayer for me that my pain is not too bad this round, I'll be eternally grateful. So thank you for watching, and bye.